Okay, good day everyone. So welcome to our rationalization for your MTOP hematology, which will be covering your WBC and your RBC anomaly. So I hope during this time you already, before we dig into the different anomalies in your the different anomalies in your RBC and your WBC, one thing that all of you must first know, must first recognize is what? All of you must first recognize the normal, okay? The normal and the abnormal before we dig into the abnormal types of your WBC. So from time to time, if needed, we will be going through some review of your RBC and your WBC. So let's get started with your first question. Now I hope you can see my screen, although I cannot zoom it in any closer. Hopefully you are still able to read the things that are presented on your screen. All right. So the first one, let's talk about question number one. So in question number one, it's mentioned it is the term used to describe, okay, it is a term used to describe an increased variation in your cell size. So remember, when there is an increased variation in your cell size, the answer is letter A. So the answer is letter A, or what we call now your anisocytosis. So remember, if our concern is the cell size of your RBC, so please do remember what is the normal size of your RBC. Okay, the normal size of your RBC is 7 to 8 micrometer. Okay, the normal size of your RBC is 7 to 8 micrometer. Now remember that 7 to 8 micrometer, okay, that is what we know to be your normocytic RBC. Now, if your RBC, okay, remember this, if your RBC is um greater than 8 micrometer or less than 7 micrometer, then there would be a problem, correct? There is a big problem when it comes to the size of your RBC. Now, let me just try to enlarge the writing because I think you cannot see it clearly though. So, maglalabas na lang ako ng um, isa pang sheet of paper. Okay? Now, please do remember when it comes to your when it comes to your um when it comes to your RBC, okay, when it comes to your RBC, laging tatandaan, your RBC, okay, ano meron sa RBC natin? That their size is usually 7 to 8 micrometer. Now, if it is less than 7 micrometer or greater than 8 micrometer, then there's a problem. Now, una nung tawag natin sa mga RBC na 7 to 8 micrometer ang sukat or the size is 7 to 8 micrometer, then we call it your normocytic RBC. Now, if it is less than 7 micrometer, then these are now what we call as what? These are your microcytic RBC. Now, if they are greater than 8 micrometer, masyadong malalaki yung ating mga RBC. We call them your macrocytic RBC. Now, your microcytic, and normocytic RBC can actually be, okay, it can actually be um, identified using your MCV or your mean corpuscular volume or your mean cell volume that has a reference range of 80 to 100 femtoliter. Now, since our question, kung babalikan natin kanina, the question was more about your sizes, okay? Now, since we're talking about your sizes, how are we going to identify the variation in your sizes? Because your MCV, everyone, we're only talking about individual RBCs. But if we're talking about the relative size of your red blood cells, what are we going to use as a marker? That will be now your RDW. And your RDW, ladies and gentlemen, okay, remember that your RDW is the one that would reflect, okay, the one that would reflect your anisocytosis, okay? Again, the presence of increased variation in your cell size is what we call your anisocytosis. What about poikilocytosis? Ano naman yung poikilocytosis? Poikilocytosis naman, that is the variation in what? Okay, correct. That is the variation in your cell shape. Okay? That is the variation in your RBC shape. Ano ba yung normal RBC shape? The normal RBC shape is what? The normal RBC shape is what? Biconcave discoid shape. Okay? biconcave discoid RBC. Now, what is macrocytosis? Macrocytosis, nakita natin kanina, these are red blood cells that has greater than 8 micrometer in diameter and an MCV of greater than 100 femtoliter. Now, what about anisochromia? Okay, what about anisochromia? O ano ba ang kulay dapat ng ating red blood cells? Okay, remember this. The normal color of your RBC, okay, the normal color of your RBC must be what? It must be, remember this, people, the normal color of your RBC is salmon pink. Okay? It is salmon pink. Now, if it is, okay, if your RBC has varying colors, some are darker, some are salmon pink, some are even bluish in color, then that is what we call now your anisochromia. Okay? Anisochromia is the difference in the RBC color, which also means that there is a problem where there is a variation in the hemoglobin content of each of your RBC. Okay? So nagkakaintindihan tayo ha, people? Okay, let's go to number 2. Okay, number 2, these are not considered to be leukocytes. Okay? These are not considered to be leukocytes. Now the choices is letter A, macrophage, letter B, eosinophil, letter C, mast cell, and letter D, T lymphocyte. Now remember, everyone, although, okay, tatandaan natin to, although in the lineage, okay, although in the lineage of our, although in the lineage of our hematopoietic stem cell, so from your hematopoietic stem cell, okay, from your hematopoietic stem cell, you have your common myeloid progenitor, and you have your common lymphoid progenitor. Although your mast cell, okay, although your mast cell belongs to your common lymphoid progenitor, it is not considered to be a leukocyte, okay? It is not considered to be a leukocyte, okay? So, kung hindi siya yung leukocyte, then that is the answer. Because your macrophage, your eosinophil, and your T lymphocytes, all of them are what? All of them are leukocytes. Now, do remember that for your macrophage, okay, for your macrophage, it is known, okay, for your macrophage, it is known to be your monocyte when found in your peripheral cell, in peripheral blood. You have your eosinophils and of course your T lymphocyte, which is a variation of your lymphocyte. Okay, number 3. Now, what is the term for cell movement? O cell movement daw through your blood vessel to a tissue. Is it diapedesis, opsonization, migration, or chemotaxis? Now, the answer for that is letter A. Okay, the answer for that is letter A, diapetesis. Now remember, okay, remember, my dear interns, that when it comes to your cell movement, dalawang bagay. Okay, when it comes to WBC, okay, when it comes to your WBC movement, you have to remember, okay, you have to remember that it can either be, okay, it can either be, kasi dito madalas nalilito. So, ano bang pinagkaiba ng chemotaxis, okay? Ano pinagkaiba ng chemotaxis sa diapedesis, okay? Remember your diapedesis, this is the movement of your WBC, okay? Kung meron kang WBC dyan, it is the movement of your WBC in and out of the cell, okay? Yung paglabas at pagpasok ng WBC natin sa ating blood vessel, we call that diapedesis. Now, sir, bakit kailangan lumabas o pumasok ng ating WBC in and out of the blood vessel? That is because of the phenomenon chemotaxis. Now, chemotaxis is the migration, okay? The migration of your WBC, okay? Migration of WBC in your into your tissue. Okay, the migration of your WBC into your tissue. But again, sir, parang yun yung tanong kanina. Yes, it is similar, but they are not quite the same. Kasi ang movement ng ating WBC, paglabas at pagpasok sa ating blood vessel, we call that diapedesis. On the other hand, your chemotaxis, okay, yan yung mismong migration ng WBC natin dun sa site of infection. Sa madaling sabi, pwede nating sabihin na ang diapedesis ay isang process within your chemotaxis. Okay? Again, it is a process within your chemotaxis. Okay? I hope we are clear with that. So the answer for the answer for number 3, okay, cell movement through your WBC or to your blood vessel, that is diapedesis. Now, number 4, Okay, let's go to number. Okay, let's go to number 4. Sabi dito, inappropriate absolute secondary erythrocytosis may be caused by. Sabi niya. So, anong keyword natin dito, mga kapatid? The keyword is secondary erythrocytosis may be caused by what? Okay? It may be caused by, dito, pwede mong isipin, sir, parang bone marrow yung problem. Baka bone marrow yung problem. Is it your bone marrow? Walang, tignan natin kung merong bone marrow sa answer. None. Okay, bakit wala? Because this is considered to be a primary cause of your erythrocytosis. Now, what about the others? Okay, what about the others? Pulmonary disease. May kinalaman ba? Okay? May kinalaman ba ang ating lungs? Okay? May kinalaman ba ang ating lungs pagdating sa production ng ng RBC? Parang wala. So that's not the answer. We eliminated. Meron tayo dito smokers polycythemia. Okay? Smokers polycythemia. Okay, we can say na, oh, probably there is an increase in your, there is an increase in your double in your RBC count. Okay, there is erythrocytosis. But again, okay, again, ang pinag-uusapan natin dito is your absolute. Okay, we are pertaining to the absolute. Okay, absolute erythrocytosis, and that is only due to what? That is due to your, again, that is due to your renal or extrarenal tumor. Sir, anong connect? Okay? Sir, bakit doon po doon, yun po yung cause ng ating tumor? It is because of your EPO. Okay? Remember everyone, okay? Remember everybody that our remember that our erythropoietin, okay, yung ating EPO, okay, your EPO is secreted by your kidneys, okay? It is secreted by our kidneys. Now, let's go to number 5. Okay, number 5, sabi dito, which of the following is the term used to describe the erythrocytes below? Okay, tingnan natin ano itsura ng erythrocyte. I do not know if you can see it clear on your end because I cannot zoom it in that much in my in the screen right now. But if you can see, there is a stack of coin appearance. Okay? Kung makikita nyo, sir, anisocytosis ba siya? Parang hindi naman. Bakit hindi? Kasi parang halos pare-parehas naman ng size. So, hindi siya anisocytosis. Kung titignan natin, okay. Kung titignan natin, sir, baka naman poikilocytosis siya. Poikilocytosis ba? Hindi naman din. Kasi, halos pare-parehas naman sila ng size ng shapes. Agglutination or roux formation na lang yung ating pagpipilian. Okay? Agglutination or roux formation na lang ang ating pagpipilian. Naku, pwede kang malito rito. But if you can observe clearly on the pictures, you would be able to see that it is actually what? A coin. Okay? It's like a stack of coin. Okay? A stack of coin appearance. Okay? Stack of coin appearance. And then, if that is the case, then it would signify that it is what? It is a Relu formation. Now remember, one of the reason why there is Relu formation is due to an increase in your protein in the body. And we can observe increase, okay? We can see increase in your we can see increase in your protein when there is inflammation in the body. Inflammation that causes the increase. Okay, inflammation that causes the increase in your zeta potential, causing the formation of your ROLU. Okay, let's go to number 6. Okay, let's go to number 6. Parang nadadalian naman kayo masyado dito sa tanong. Folate and vitamin B12 work together in the production of what? It works well in the production of your DNA. Okay? Now, folate and vitamin B12 deficiency can actually affect your RBC. Sir, bakit naman po? Because it can cause okay? It can cause macrocytic RBC. Okay? If your vitamin B12 and your folate are both decreased, then it will lead to your macrocytic RBC, which you also observe in some parasitic infection. Okay? Kaya tatandaan ninyo, meat is a very important pa rin sa ating diet. Although if you're a vegetarian or a vegan, you can opt to have food that has rich that are rich sources of your vitamin B12 and your folate as well. Okay, let's go to number seven now. Okay, number seven. What is the major type of leukocyte seen in the peripheral smear of patient with aplastic anemia? Okay, again, ano daw yung leukocyte? Okay, ano yung leukocyte na seen mostly in in the peripheral smear of patients with aplastic anemia? Now remember everyone, generally kapag may aplastic anemia tayo, okay? Generally kapag may aplastic anemia ang isang pasyente, okay, kapag may aplastic anemia ang pasyente, majority of the blood cells, okay? Majority of the blood cells are decreased, okay? Majority of the blood cells are increased. Why? Because our body fails now to make blood cells, okay? It fails now to produce our blood cells like your RBC, your WBC, and even what? Even your platelets, okay? Even your platelets. So, please do remember, okay, please do remember na um, there are, okay, so bakit nga lymphocytes yung ating mataas? Because there are some cases, okay, some cases or some etiologic causes of your aplastic anemia being autoimmune. Ibig sabihin, okay, it is actually um, being hypothesized, okay, being hypothesized that the T cell, okay, your T cells, what are T cells? Your lymphocytes. Your lymphocytes are actually the one that initiates the destruction of your bone marrow, eventually leading to the defective or nearly absent hematopoiesis or hematopoietic cell in the body. Okay, so tatandaan ninyo yan ha when it comes to our aplastic anemia. These are your lymphocytes. Why? Because we are actually considering, okay, we are already considering your anemia as an autoimmune disease. Okay? It is an autoimmune disease that destroys your bone marrow. Okay, let's go now to your um question number 8. So there's a picture here. From afar, you can see that there is, you can see, no, from afar that you have a red blood cell. If we're going to zoom it in, there is a central pallor, but within the central pallor is a hemoglobin formation as well. So what do we call this type of cell? Okay, anong tawag natin sa ganitong klaseng cell? Now, we call it your podocyte. Okay, we can call it your podocyte. We can also call it your Mexican hat cell. Okay, Mexican hat cell. So maraming pwedeng tawag para sa ating madaming pwedeng tawag dito sa ating RBC na ito. So you can see that if you're going to look at it on a different view, okay, it looks like a cup, okay? Para siyang goblet or para siyang cup. So this is your podocyte, this is your target cell, and we also call it your target cell, your Mexican heart cell, your bull's eye cell. But ang tanong, saan natin to nakikita? Can we see it in iron deficiency anemia? No, because that is microcytic hypochromic RBC. Megaloblastic anemia, no. We are seeing this we are seeing macrocytic RBC here, okay, with with big central pallor, meaning to say hypochromic siya. What about RH null? RH null is not associated, okay, with podocyte because it is only your thalassemia, okay? Among the choices, it is only thalassemia that is associated with your podocyte or your Mexican heart cell. Now let's go to number 9. Okay, sabi niya dito, which of the following RBC abnormality is usually seen in microangiopathic hemolytic anemia? Now, first, let us try to identify ano yung mga nakikita niyo sa screen. Now, what you see on the screen is not a it's not associated with your microangiopathic anemia. Bakit? Ano itong nakikita nyo? This is Howell-Jolly bodies. Okay? This is Howell-Jolly bodies. Okay? And these are DNA. So, hindi yan yun. What about this one? Letter C. So, para makikita mo, ay, ba't ganun? Ba't parang fragment siya? Okay? Because what you see here on letter C, these are schistocytes. Okay? Schistocytes or even schizocytes. Okay? These are schizocyte or schistocyte. What about here? Dito makikita natin, ano naman yung nakikita nyo dito? Ay, para siyang mouth. Okay, para siyang mouth. It looks like a mouth. Okay, that's correct because these are stomatocytes. Okay? These are stomatocytes. So makikita niyo naman dito sa kabila, sir, parang hindi naman yan because parang silang sickle cell shape kung titignan. Yes, that is correct. Because these are your sickle cell. Okay, these are sickle cell, also known as what? Also known as your drepanocytes. Okay, also known as your drepanocytes. Your your stomatocytes is associated in your RH null, your your RH null, and even in your liver diseases. Your sickle cell is obviously involved when it comes to your is involved in your sickle cell anemia. Your Howell-Jolly bodies is due to the improper formation or the naturation of your DNA. Now, it leaves us now only with your answer, letter C, which is schizocytes. So remember, schizocytes or schizocytes are formed due to microangiopathic hemolytic anemia. So when you say microangiopathic hemolytic anemia, there is an abnormal hemolysis intravascularly of your red blood cells. Now, what you see on your screen in letter C, these are actually fragments. After mag-lyse ng ating RBC, yan yung nafo-form, yung mga nasira na ating mga red blood cells. Okay, malinaw? So please take note of that. Number 9, your schistocyte. Okay? Let's proceed now to question number 10. Which of the following result is consistent now with your hereditary spherocytosis? Now, there are two things that you can remember when it comes to hereditary spherocytosis. First and foremost, they are big, and because of when your RBC are sphere in shape already, okay, kapag spherocytes na, okay, yung ating mga RBC, one thing that decreases or one defect in the RBC is actually their cell membrane. When their cell membrane is decreased or the capacity of their cell membrane is decreased, the influx of your sodium and your potassium, okay, the entry and the exit of your potassium is also increased. This involves now, okay, this involves now your RBC getting bigger and bigger and eventually lysing. Okay? So anong ibig sabihin nun? Because of the changes in the osmotic pressure in the blood, okay, in the blood, or technically, kunwari, nilabas natin, we are already doing your osmotic fragility test. In vitro, okay, in vitro, RBC, okay, RBC that has problem in their cell membrane, like say, for example, the one that we see in hereditary spherocytosis would have an increased osmotic fragility. Okay, mag-i-increase yung kanyang osmotic fragility. So, ibig sabihin, pwedeng letter A, pwedeng letter C. However, okay, when it comes to your hereditary spherocytosis, remember that there is no involvement, okay? There is no involvement of your antibodies or your complement. Now, if that's the case, then we are looking for a negative that result. Remember that a positive direct anti-hemogl direct indirect when it comes to your that, okay, when it comes to your that, lagi yung tatandaan na that is positive if there is an attached immunoglobulin or complement in your RBC membrane. Do we have that in hereditary spherocytosis? We do not, okay? We do not have that. Hence, we can say that when it comes to your hereditary spherocytosis, okay, when it comes to your hereditary spherocytosis, the answer is letter A. Increased osmotic fragility with a negative that result. Okay, let's proceed now to number 11. Okay? Number 11. Sabi dito, in men and postmenopausal women whose diet are adequate, iron deficiency anemia. Okay, sabi dito, iron deficiency anemia. So kung lalaki ka daw at postmenopausal women na may adequate, okay, adequate iron, okay, adequate rather diets are adequate, iron deficiency anemia daw. Ano, adequate naman yung diet mo, pero bakit ka may iron deficiency anemia? What will be the possible cause? Increased need associated with aging? No. Impaired absorption in gastric mucosa? No, it doesn't affect whether you're men or you're aging or you're a postmenopausal, hindi naman po yun factor sa ating absorption. Diminished break resistance to hookworm infection. So resistance to hookworm, that's not the case. Okay? Or diminished resistance to hookworm, that's not the case. And the only answer for this one is what? Letter C. Okay? Remember other remember that remember that your iron is being excreted on a regular or at a normal rate. So only 1 to 2 milligrams of iron, okay? Only 1 to 2 milligrams of iron is excreted, okay? 1 to 2 milligrams of iron ang excreted, okay? Excreted. Bakit 1 to 2 milligrams lang? Because, okay, in the body, we only absorb 1 to 2 milligrams. So 1 to 2 milligrams ang intake 1 to 2 milligrams lang din ang i-excrete ng ating katawan. Now, sir, sabi nga dito may iron deficiency anemia daw. Yes, may iron deficiency anemia because of other causes of bleeding. Okay? So, ibig sabihin may bleeding sa ating katawan. So, sa ano bang sagot? Yung merong bleeding, only letter C, pertaining to your chronic gastrointestinal bleeding. Okay? So, let's go to number 12. Okay, number 12. A 7-year-old girl was seen by her physician several days ago and was diagnosed of pneumonia. Her mother has brought her to the physician because the girl's urine, okay, began to darken after the first visit and is now alarmingly dark. Okay? The girl has no history of anemia. Wala naman daw history ng anemia and there is no family history. ECBC shows, okay, ito na, mild anemia, may polychromasia. Ano yung polychromasia or anisochromia? Color ng RBC natin, iba-iba. Few schistocyte. So, ibig sabihin, nakita mo na agad, may schistocyte. What anemia would it be categorized? Kapag nakita na natin may schistocyte, ibig sabihin lang nito, okay, ibig lang sabihin nito, merong hemolysis, okay? Merong hemolysis. And if you were able to see that in your PBS, okay, it only means that the lysis of your cell, okay, happens intravascularly. Meaning to say, sa loob ng ating mga blood vessel. So alin ba dito yung may intravascular? So intravascular. Sabi dito, is it acquired or hereditary? Kung makikita natin kung acquired or hereditary siya, kung makikita natin, no family history, no history rin of anemia, then it only is suggestive that it is an acquired type. Okay? It is an acquired type. Ladies and gentlemen, during this types of question, you need to be able to um eliminate the correct and the incorrect answers. Okay? Number 13. Punta tayo sa number 13. Sickle cell anemia daw ang ating concern. Sickle cell disease is usually what? Okay? Sickle cell disease are usually normocytic and normochromic. Okay? So if you are going to review your notes, everyone, makikita nyo na ang ating sickle cell are normocytic and normochromic. They just become trypanocytes or they just become sickles in shape when nagiging sickle lang yung shape ng ating RBC when kapag may problem tayo saan when we do have problem in your oxygen or when there is hypoxia in your patient. Okay, but for as long as normal yung oxygenation, yung ating mga RBC would remain to be a normocytic normochromic RBC. Okay? Then let's go to number 14. Ayan. Number 14, alam nyo ba dati nung panahon namin, iba ang pangalan ng parasite na to. Now the fish tapeworm, okay, your Diphyllobotrium latum, okay, your Diphyllobotrium latum or your dilatum. Ang dilatum ngayon ay iba na po ang pangalan. Okay, your dilatum, okay, ano yung new name? Okay, ano yung new name ng ating dilatum? Remember that the new name of your dilatum, okay, your dilatum Okay, your dilatum is now your dibotryocephalus latus. Okay, again, it is now your dibotryocephalus latus. It is formerly known as your Diphyllobotrium latum or your broadfish tapeworm. And kung matatandaan ninyo, ang ating um, Dibotryocephalus, okay, latus or your dilatum causes your what? Megaloblastic anemia. Okay? Your megaloblastic anemia or pernicious anemia, deficiency in your vitamin B12. Okay? And it leads to what? The formation of your macrocytic rather. Again, let me repeat myself. It leads to the formation of your macrocytic RBC. Okay? Macrocytic RBC. Okay, let's move forward to your um question number 15. Okay, and question number 15, okay? Question number 15, ang ating tanong ay in PV, okay? In PV or PV polycythemia vera, okay? In your polycythemia vera, what is the characteristic um characteristically seen in your peripheral blood? Now, ano yung nakikita natin? Isa-isahin natin. There is myellosis. Mataas daw ang ating um, mataas daw ang ating mga WBC. Yes, pero hindi lang po WBC. Remember in your polycythemia vera, there's an increase in your RBC, your WBC, and even in your platelets. Okay? So, meron daw pancytopenia. Ibig sabihin ng pan is all. Sabi ng cyto, ibig sabihin ng cell. Pinya, decrease. So, hindi po yan ang tamang sagot. Panhyperplasia. Okay? Panhyperplasia, lahat daw ng cell nag-i-increase in cell production. Hindi po yan ang sagot. Now, pan-myelocytosis, lahat daw ng ating myelocyte ay nag-i-increase. No, kasi sabi nga natin, ang atin pong polycythemia vera, mataas ang RBC, mataas ang WBC, mataas din ang platelet. So, anong tamang sagot? Pancytosis. Okay? Pan, ibig sabihin, ibig sabihin all. Cyto, meaning to say cell. Okay, cytosis, meaning to say an increase in all types of cell, which means now your RBC, your WBC, and your platelet are increased. So that is your polycythemia, okay, polycythemia vera. Okay, polycythemia vera. Now let's go to number 16. Okay, in your number 16, sabi niya, schistocyte, ovalocyte, acanthocytes are examples of abnormal changes in your RBC. Tama, mali? Tama. Ano siya? Volume? Hindi po. Shape? Yes. It is your shape. Inclusion? Hindi din. Okay, inclusion? Hindi. Okay, hemoglobin content? Hindi. Okay, number 17. The presence of what? The presence of hypochromic cell and normal chromic cell on the same film. Okay, meron ka daw mapupusyaw at normally color na cell sa same na peripheral smear is what we call your anisochromia or dimorphic anemia. Okay? This is a characteristic of which of the following? Sideroblastic hypochromic anemia after transfusion with normal cell, iron therapy for iron deficiency anemia, and that only leaves us now with the answer, all of the above. Okay? So, ang sideroblastic anemia, meron kang mga um, normally hemoglobinized cell at meron ka ding hypochromic cells. At dito naman sa ating letter B, totoo, meron siyang hypochromic anemia. Kaso, kakatapos lang daw ng transfusion ng normal cells. So, you will be able to see anisochromia there. So, iron deficiency anemia na meron ng therapy, then you will be able to see half-half. Okay? The answer is letter D. Again, all of the above. Okay? Again, all of the above. Now, let's go to your number 18. Okay? Acanthocytes. Sabi niya dito, acanthocytes are usually associated with what? Associated ba siya with vitamin B12 deficiency? No, that is macro. Okay? Macrocytes. Okay? G6PD deficiency, no, hindi po. Heinz bodies po ang nakikita natin. RH null po, no, hindi po. Liver disease po yan. Tsaka RH, ang nakikita po natin dito are stomatocytes. Okay, stomatocytes. Ang tamang sagot ay beta lipoproteinemia. Gusto ko itong tandaan lagi as a, Acanthocyte, beta lipoproteinemia. Okay? A, a, a. Aha. Okay, number 19. What is the cause of this RBC anomaly? Okay, what is the cause of this RBC anomaly? So again, these are what? These are stomatocytes. Okay? These are stomatocytes. Now, stomatocytes are usually seen in what type of diseases? Sabi natin last time, ang stomatocytes natin, okay, stomatocytes are usually seen in your RH null, okay? In your RH null, RH null, your stomatocytes or your mouth cell are usually seen in your RH null disease, okay? And because of your RH null, because patients are RH null, okay, patient with RH null, ano naapektuhan pag RH null yung isang pasyente? Naaapektuhan yung kanyang yung kanyang RBC membrane. At pag naapektuhan yung ating RBC membrane, ano yung problema natin? May problem tayo sa membrane cation permeability. Okay? Ang problem natin ay sa ating membrane cation. So remember that when it comes to your red blood cells. Okay? Remember that when it comes to your red blood cells. Okay. Let's go na to your paroxysmal nocturnal hemoglobinuria. Episodes are usually associated with what? Paroxysmal nocturnal hemoglobinuria are usually associated with letter what? Letter C. Okay? Your paroxysmal nocturnal hemoglobinuria, okay? Your paroxysmal nocturnal hemoglobinuria is actually, okay, it is a rare blood disorder, okay, a rare blood disorder that is actually due to an increase, okay? Paroxysmal kasi wala siyang cause, kumbaga wala siyang warning, wala siyang idiopathic, sudden lang siya. Bigla na lang may ganun na hemoglobinuria, presence ng hemoglobin or ng reddish color sa ating urine, which only happens at night, okay? Which only happens at night. Okay, so that is number 20. Okay, answer is your paroxysmal nocturnal hemoglobinuria happens during your sleep. So we assume, okay, actually medyo ano to medyo fall ano siya. Ang ano natin, sir, paano pag hindi naman ako natutulog ng gabi? Well, kung hindi ka natutulog ng gabi, then remember, ang pinaka-idea lang nito kasi itong question number 20, it happens at night. Okay, it happens at night. So we assume na tuwing gabi, sana nakakatulog tayo. Diba? Sana all nakakatulog sa gabi. Okay, let's go to number 21. Okay? In your paroxysmal nocturnal hemoglobinuria, okay, it is characterized by a flow cytometry result of which of the following. Okay? Again, let's try to eliminate answers kasi baka nakita natin, hala shucks, hindi ko to kayang sagutin kasi puro mga CD, CD, CD. How can we now, okay, how can we now identify or how can we now differentiate it from the others, okay? How can we differentiate it now with the others? Now, remember, when it comes to your paroxysmal nocturnal hemoglobinuria, okay, there is an abnormal um, protein. Okay, there are abnormal proteins or rather absence of important protein in your cell membrane. So unang-una doon, ano yung mga protein na yun? Tandaan ninyo ating RBC, aside sa antigen, marami rin protein sa kanyang surface. Now, is the problem CD4 or CD8? No. Kasi talagang negative naman sila because you are only able to find it in your lymphocyte. Okay, so positive for all normal CD? Hindi nga. May kulang nga, kaya nga may PNH. Now, kung may kulang, ano yung kulang na yon? They are negative to your CD55 and your CD59. Okay, your CD55 and your CD59 are important in preventing, okay, in preventing the activation of your complement. Okay? The activation of your complement. So if you don't have CD55 and CD59, then your RBC will eventually be lyse. Okay? Eventually, walang inhibitory protein. Okay? Walang inhibitory protein doon sa ating walang inhibitory protein doon sa ating mga complement dahil wala ka rin nung DAF, okay, wala ka nung DAF, then that will lead now to your what? That will lead now to the rupture or hemolysis of your red blood cells. Okay, so for number 21, again, the answer, okay, the answer for number 21, hello, again, the answer for number 21 is what? The answer for number 21 is letter A, negative CD55 and CD59. Okay? So let's move forward. Okay, let's move forward number 22. Okay, what are the initial laboratory tests out to diagnose your initial your anemia? So halos magfo-fall sa CBC. So makikita natin lahat ba may CBC? Okay, RBC, ito wala, ito wala. So ang hinahanap natin CBC, CBC. Next, ano yung kailangan mong makita? We need to also check, okay? We need to actually check bago ka mag reticulocyte count. You need to check your peripheral blood smear muna. Okay? And eventually your reticulocyte count to check if your bone marrow is properly compensating your anemia. Okay, so the answer is letter what? The answer is letter, okay, tatandaan, ang sagot po ay letters P. You have your CBC. Okay, unang-una dyan, dapat may CBC. Tapos susundan mo ng peripheral smear. And then eventually your reticulocyte count to just identify if your body is properly, or rather your bone marrow is properly compensating with that decrease. Okay? Let's move forward to number 23. Sabi dito, the degree daw. Okay, degree of effective erythropoiesis is best assessed, o kakasabi ko lang kanina, paano natin malalaman kung properly nakakapag-compensate ang ating bone marrow sa kakulangan sa ating RBC? Ano yung pwede nating tignan doon? That is your letter D, your reticulocyte count. Okay? Your reticulocyte count. Okay, number 24. Number 24, the primary pathophysiologic mechanism of anemia with chronic kidney disease. O babalikan natin kanina yung tanong dun sa unang part ng ating ratio. Tatandaan na kapag mayroong problema sa kidney, okay, kapag mayroon daw tumor sa kidney, overly active yung ating kidney, ano yung nangyayari? Nag-i-increase yung ating erythropoietin. Nag-increase erythropoietin, produce ng RBC. Pero kabaliktaran din noon ay totoo. Kapag ang ating kidney ay nasira, kapag ang kidney natin ay nasira, what will also happen? When your kidneys are destroyed, okay, when your kidneys are destroyed, that could also be a problem. Specifically, your kidney will no longer be able, okay, your kidney will no longer be able to what? It will no longer be able to produce enough numbers of erythropoietin. And if that happens, sir, ano pong mangyayari kapag yung aking kidney hindi na po nakakapag-produce ng erythropoietin? Kapag wala ng erythropoietin, then that will lead now to what? It will lead now to a decrease, okay? It will lead now to a decrease in the production of your red blood cells, okay? So mababa na din ang pag-increase, okay, ang pag-produce ng ating red blood cells, okay? So ang tamang sagot po dyan is letter A, okay? Mababa na yung production ng ating EPO. Okay, number 25. Number 25, meron daw tayong iron deficiency anemia. Tatandaan ninyo, interns, kapag mayroon kang iron deficiency anemia, ano yung meron? Microcytic, okay? At dahil meron kang IDA, wala ka masyadong hemoglobin, anong mangyayari? you have hypochromic RBC. Okay? Ano yung paano natin malalaman kung may microcytic RBC? We use your MCV. How about hypochromic? We use your MCHC. So ano yung expect natin? Mababang MCAV at mababang MCHC. Tingnan natin. So dito, ang sa hinahanap natin, decrease MCV. Decrease MCV. Decrease MCV. Aba, tama. What about your MCH? Remember this, everyone. Ang MCH natin are generally not helpful when it comes to classifying your anemia. But for the sake of this question, titignan natin, dapat mababa ang ating, ba't mababa? Sir, bakit naman mababa rin yung MCH? Kasi nga, hypochromic yung pinag-uusapan natin. So, mababa din ang ang kanyang MCH. So, saan natin makikita yung mababang MCH? Hanapin natin, decrease MCH, decrease MCH. So, ang pagpipilian na lang natin ay dalawa. Okay, pinagpipilian na lang natin ngayon ay dalawa. So, ano yung sabi natin? Dapat decrease din yung kanyang MCHC. So, decrease MCHC, which leads us now to letter B. Okay? So, microcytic hypochromic RBC. Number 26. In your intravascular, sabi intravascular sa loob daw ng ating blood vessel. Hemolysis is suspected, but hemoglobinemia, okay, sabi dito, meron daw pinanghihinalaan. Meron daw pinanghihinalaan na ano, meron daw pinanghihinalaan na intravascular hemolysis. But hemoglobinemia is not detected visually or spectrophotometrically. Ano yung kailangan nating i-check para malaman ito? Ang sagot po ay letter C. Okay, your serum haptoglobin. What are haptoglobin? Haptoglobin are the carrier molecule for your hemoglobin. Okay? They're the carrier molecule for your hemoglobin. It is your hemopexin, hindi. That is for your heme. Okay? That is for your heme. Your lactate dehydrogenase, hindi. Ang hinahanap natin ay hemoglobinemia. At ang tamang sagot lang ay letter C. Kailangan natin makita yung nagdadala. Okay? Kasi baka kaya hindi mo ma-measure yung ating hemoglobin kasi it is already bound. Okay? It is already bound to your haptoglobin. Okay? It's already bound to your haptoglobin. Okay? Number 28. Number 28 tayo. Number 28, meron daw tayong megaloblastic anemia. O ano bang meron kapag may megaloblastic anemia? Okay? Pag may megaloblastic anemia, MCV natin ay mataas. Ang ating MCH ay mababa. Rather, mataas. Okay? At ang ating MCHC ay kadalasang normal. Okay, hanapin natin kung nasan yun. MCV daw increase, MCV na normal, mali. Increase, tama yan, tama, tama. MCV daw na increase, MCH na decrease, hindi. Okay, increase, normal. Ayan, ang sagot ay letter A. Your V is increase, MCH is increase, and your MCHC are usually normal. Let's go to number 29. Number 29, which of the following is the most definitive test? Okay, definitive test daw. Definitive test for your hemoglobin S. Saan natin nakikita si hemoglobin S? Sa sickle cell. Okay, sickle cell anemia. Hemoglobin solubility test? No. Hemoglobin electrophoresis and an alkaline? Hindi. We cannot separate them. Osmotic fragility? No. The correct answer is only letter D. Okay, hemoglobin electrophoresis at acid pH. Bakit? Because when you are using your alkaline pH, alkaline pH, okay, for using your pH pagdating sa sa electrophoresis, there are other hemoglobin that overlaps. Okay, there are other hemoglobin that overlaps with your hemoglobin. So for you to be able to separately identify them from one another, we should be using an acid pH for your electrophoresis. Okay, number 30. Okay, number 30, excessive amounts of iron. Sabi dito, may excessive amount ka daw ng iron that accumulates in the bone and in the blood and in your tissue. So, excessive amount ng iron. Iron accumulation in the macrophages, okay, iron accumulation in the macrophages is what is causes, okay, little parenchymal cell injury. The answer there is hemosiderosis. Now, hemosiderosis and hemochromatosis are both, okay? Your hemosiderosis and hemochromatosis are somehow, so pwede natin sabihin, okay, hemosiderosis and your tawag dito, hemosiderosis and your hemochromatosis, we can say na yes, they are both accumulation of your iron, okay? Both accumulation of your iron, but again, okay, it the your hemochromatosis, okay? Your hemochromatosis is more what? Your hemochromatosis is more severe compared to your hemosiderosis, okay? Your hemosiderosis, rather your hemochromatosis is more severe, okay? It's more severe compared to your hemochromatosis. Okay? So, sa hemosiderosis kasi, there is actually none, uh, little to no organ damage. But when it comes to hemochromatosis, dito tayo merong bigger parenchymal damage and bigger tissue damage. Okay? Number 30 is hemosiderosis. O, ito naman, tinanong agad. Ayan. So, meron na siyang tissue injury or organ damage, then that is your hemosiderosis. So sana malinaw ha, si hemosiderosis parehas silang accumulation ng iron. Pero yung isa, may anong nangyayari? Yung isa naninira, it destroys, okay? The 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 hemochromatosis destroys your tissue or your organ. In your hemosiderosis, there is accumulation. Yes, there is a slight injury, but compared to the one caused by hemochromatosis, mas malala siya. Okay, number 32. It is characterized by the absence or decrease in the synthesis of more globin subunits. Okay? So, ang porphyria, ano yung problema natin sa porphyria? Ang problema natin, yung heme. Okay? Sa IDA, ang problema natin, si iron. Sa hemoglobinopathies, okay, sa hemoglobinopathies, ang problema natin mismo yung ating hemoglobin. Sa thalassemia, ano yung problema natin? Yung ating mga globin chains. Okay, remember sa thalassemia, dito nagkakaroon ng substitution, elimination ng ating mga amino acids. Okay? So, answer in number 32 is thalassemia. Okay, answer in number 32 is thalassemia. Okay, number 33. Okay, number 33. Which of the following, which major hemoglobin is seen in sickle cell trait? Madali lang naman to. Hemoglobin S, hemoglobin F, hemoglobin A2, or hemoglobin A. Okay, which is the main, again ha, everyone. Pwede kang masasabi mo, sickle cell. So, dapat hemoglobin S. Hindi. Okay? Kasi ano yung tanong? Ang tanong is, ano daw yung major hemoglobin found sa sickle cell trait? So, ibig sabihin, sa sickle cell trait, meron kang hemoglobin S, pero carrier ka nung gene, pero sickle cell trait ka lang. Hindi ka sickle cell disease na full blown. Okay, so anong meron ka majority? Hemoglobin. Ano yung meron ka majority? That is hemoglobin A2. Rather, hemoglobin A. Okay? Hemoglobin A. Okay? At ang hemoglobin A mo is composed of alpha and beta globin. A2, alpha, and delta. The rest, those are abnormal hemoglobin. Okay? Now, number 34. Number 34, which of the following is not associated? Not associated daw, kapatid, not associated with hemolytic anemia. Isa-isahin natin. Kung ano ninyo nakikitang nakabold yung sagot. Letter A, decrease hemoglobin and packed red cell, hemolytic anemia, and decrease, not associated pala, not associated. So, decrease hemoglobin and packed red cell, yes. Increase retic, yes, kasi nga nagko-compensate. Increase serum haptoglobin, Okay, increase daw yung serum haptoglobins. The answer here is actually decrease. Okay, dapat decrease yung haptoglobin. Bakit decrease yung haptoglobin? Kasi lahat ng hapto nakakabit kay hemoglobin. So, ayan, decrease RBC survival. Yes. The answer is letter C. Bakit po increase serum haptoglobin? Kasi dapat decrease po siya. Okay? Dapat decrease ang ating haptoglobin. Number 35. Okay. Number 35. Hemoglobin A2 quantification is most often used to identify individuals with what common hemoglobinopathy. Okay? That is for your beta thalassemia. Okay? Again, number 35. That is for your beta thalassemia. Dito sa iba, medyo straightforward yung question. So number 36, the sugar screening, water screening test should be performed within blank hours after obtaining your blood. Remember, when it comes to your red blood cells, ang basic na processing time natin should always be within 2 hours. Okay? Within 2 hours, because after 2 hours, your RBC membrane, your RBC shape will now start to have some morphological changes. And when that happens, okay, and when that happens, anong mangyayari? Yung ating RBC mas mabilis maglalays. Okay? Number 37, the use of defibrinated blood for sugar water test. Ano yung the use of defibrinated? Okay, defibrinated will cause your letter A, false positive. Okay? Dapat, in a sense, yung ating specimen for sucrose or for your sucrose hemolysis test, it should be your citrated blood. So that, okay, kasi pag defibrinated, it will only lead to a false positive results. Okay. Okay. Pardon with that. Let's go na to number 39. Okay, number 39. This cell daw is usually seen in patient with what? Kung makikita ninyo, hala, ano ba yung cell na yan? Okay? Yung cell na yan ay parang helmet. Tama? Yung cell na yan ay parang kinagatan. Okay? That is because we call it your helmet cell or your bite cell. Sir, bakit ba may helmet cell or may bite cell? Unang-una yan, dahil yan sa presence ng Heinz bodies. May Heinz bodies ka, bakit? Dahil meron ka pong glucose 6-phosphate glucose 6-phosphate dehydrogenase deficiency. Now, the deficiency in your glucose 6-phosphate dehydrogenase deficiency, okay? Kapag wala kang glucose 6-phosphate dehydrogenase, anong nangyayari? Nagkakaroon po ng denaturation ng ating hemoglobin. Now, remember, sir, bakit po nagkaroon ng high bodies? Remember sa spleen, okay, sa spleen mo, it can perform your calling, okay, or your pitting, okay? Ang calling ginagawa kapag ang ating RBC ay talagang wala ng chance, okay? It will eventually destroy your RBC. Sa pitting, ito yung mga pwede pa, may kailangan ng eretoke, may kailangan ng tanggalin, kaya tinatanggal ng mga splenic macrophage natin ito through pitting. Ano yung ibig sabihin ng pitting? Kinakagat nila yung ating RBC para matanggal yung deformity o yung problema sa RBC. Now, what happens here? Okay? In your splenic calling and your splenic pitting, ito ang tatandaan ninyo. Sa splenic calling at sa splenic pitting, meron tayong matinding criteria. At ang criteria yan ay 3M. Ano ibig sabihin ng 3M? Okay? Ibig sabihin ng 3M ay matanda, okay? Mapangit na RBC, at matabang RBC. Okay? Matabang RBC, bakit mataba ng RBC? Kasi nga, na habang tumatanda ang RBC, habang lumalapit sa 120 days na kanyang lifespan, anong nangyayari? Yung kanyang size ay nagsuswell, lumalaki, kaya siya tumataba. Okay? Ang RBC natin kapag matanda, mapangit at mataba, sila ay mag-undergo ng splenic colic. Pero kapag meron lang mga deformity, pitting muna bago calling. Okay? So, ang sagot po sa number 39 ay glucose 6-phosphate dehydrogenase deficiency. Number 40. Okay, number 40. The pathophysiology of immune hemolysis with IgM antibodies always involve, okay, IgM antibodies always involves what? It always involves letter A, your complement, your autoantibodies, your abnormal hemoglobin, or your allo antibodies. The correct answer here is, since we're talking about IgM, we're talking about your complement. Okay? We're talking about your complement. Number 41. Number 41, which of the following erythrocyte inclusion can be visualized with supravital stain? Again, supravital stain, we are visualizing your RNA, okay, or your DNA. Basophilic stippling, ang sagot dito, which of the following can be visualized with supravital stain? Okay, so lahat RNA, DNA. So lahat ba ito ay nakikita? Okay, yes. But cannot be detected using your right stain. Basophilic, kita. Howell Jolly bodies, yes. Siderotic granules, yes. And it only leaves us now with your Heinz bodies. Again, Heinz bodies are visible using your supravital stain. Pero pag gumamit ka ng right stain, pag ang ginamit mo is yung methylene, using methylene blue at yung iyong buffers, your sodium phosphate or your H distilled water, hindi mo makikita ang ating Heinz bodies. You need to use what? You need to use your supravital stain. Your supravital stain, example of your supravital stain are your what? Example of your supravital stain are your brilliant crescent blue, your new methylene blue to identify them. Okay, let's go to your number 42. Okay, in your number 42, Donut Landsteiner test, positive daw. Okay, syempre, walang paligoy-ligoy, that is your PCH or your paroxysmal cold hemoglobinuria. Okay? Paroxysmal cold hemoglobinuria. Okay. Which antibody naman daw yung associated sa ating PCH? That is the presence of your anti-P. Okay? Your anti-P antibody. Okay, number 44. Disseminated intravascular coagulation. Okay, disseminated intravascular coagulation differs from thrombocytopenic purpura in the way that both of them, tatandaan ninyo, both of them mababa ang platelet. Pero ano yung pinagkaiba nilang dalawa? Okay, let's check. Okay, letter C. Okay, ang ating DIC, mababa ang coagulation, ang kanyang coagulation factors or coagulation protein. So this means that both your PT and PTT are prolonged. Number 45. Number 45, pure red cell aplasia. Okay? Pure red cell aplasia. So, pure red cell aplasia, is it Bernard-Soulier? Hindi. Di Guglielmo's disease? No. Fanconi? No. The only answer is letter C. Okay, latandaan, pure red cell, only red cell ang mababa, that is diamond black fan anemia. Okay, number 46. Pag sinabi daw idiopathic, anong ibig sabihin pag idiopathic? Pag sinabi natin idiopathic acquired aplastic anemia, ano ang cause? Drug reaction? Hindi. Benzene? Hindi. Inherited daw? Hindi. Hindi kasi natin alam. Kaya siya tinawag na idiopathic acquired aplastic anemia. We do not know. There is no known cause for that disease. Number 47. Okay? Asynchronous development of your hematopoietic cells in the body. In hematopoietic cells, ibig sabihin na synchronous, hindi sabay, na development ng ating hematopoietic cell, okay, which will lead to which of the following? Letter D. Okay, there will be an impaired DNA synthesis in our body. Na number 48, identify the WBC shown. Okay, as you can see, this is your neutrophil, but if you can see, it is like an old, it looks like an old, not an old guy, an old man eye. Okay, parang eyeglass ng old man. So it signifies what? It signifies your letter A, your Pelger-Hewitt anomaly. Okay? Your Pelger-Hewitt anomaly. Okay, your Pelger-Hewitt anomaly are usually seen. Okay, it is an autosomal dominant disorder that, as you can see, makikita ninyo may coarse clumping yung ating mga chromatin. You cannot see it clearly, but again, there is a decreased segmentation. Okay? Di ba ang ating tawag dito, ang ating neutrophil dapat, 'di ba, 3 or more lobes, okay? More than 3 lobes, okay? More than 3 lobes usually siya. 3 to 4 actually. Kasi pag sobra naman, hypersegmentation naman siya. So usually, di ba, 3 to 4 yung lobes ng ating neutrophil, okay, ng neutrophil natin. But in this case, hindi ganun yung nangyari kasi nga, meron kang Pelger, Hewitt anomaly. Okay? So, answer is letter A. Okay? Answer is letter A. Now, let us just go through the other one, your Alder-Riley naman, your Alder-Riley anomaly, ano yung palatandaan sa ating Alder-Riley anomaly? Ano yung problema natin dito? Sa Alder-Riley anomaly, meron kang dark staining granules, and this is because of your mucopolysaccharide. So, ang problema natin dito, carbohydrate. Kay Chidiac Higashi. Okay, kay Chidiac Higashi, ano naman yung problem natin? Kay Chidiac Higashi. Kay Chidiac Higashi, meron ka namang problem in ingesting your bacteria. Okay, ingesting your bacteria, and this would lead now to what? Meron kang impaired na pagsira ng mga bacteria or microorganism. Your Mayheglin naman, ano naman problema natin kay Mayheglin? Ang Mayheglin naman natin, ang problem natin, um, meron kang mga inclusion bodies in your granulocytes, including your monocytes. Okay. Number 49. Okay, chronic granulomatous disease. Okay, may chronic granulomatous disease daw tayo. Problem natin dito is your digestion or destruction of your bacteria. The answer here is all of the above. Remember, um, because of the deficiency in your superoxide, your hydrogen peroxide, and your hypochlorite, you cannot, okay, or you are incapable of destroying your bacteria. Okay, ito, medyo familiar na. Sabi natin dito, meron siyang large coarse irregular lysosomal granules, okay, in the cytoplasm of your granulocyte and your monocyte. Dole bodies ba sa monocyte? Hindi. Mayheglin? Hindi. Okay? Alder-Riley, hindi. Ang sagot ay letter B, Chidiac Higashi. Number 51. Number 51, the familial disorder featuring pseudo-Dole bodies. Okay, pseudo-Dole bodies, thrombocytopenia, and large platelet is letter D. Okay? Bakit letter D? Kasi meron na pong involvement ng thrombocytopenia and presence of large platelets. Number 52. Number 52, which of the following inherited leukocyte disorder, okay, is a common mutation of your lamin B receptor? That is letter A, your Pelger-Hewitt anomaly. Number 53. Number 53, a definition of leukemia could include overproduction of your leukocyte. Yes na yes. Solid malignant tumor in your lymph nodes, not necessarily, because this is also applicable to other cancer or other tumor. Malignant cell trespasses the blood-brain barrier. Yeah, letter D. Both A and C. Okay, Alder-Riley anomaly closely resembles which of the following? Alder-Riley, kung matatandaan ninyo, anong meron kay Alder-Riley? Sa Alder-Riley, meron kang dark stain ng mga granules. So, sinong pinakakamukha niya? Our rods, hindi. Hypersegmentation, hindi din. Dull bodies, no. Only toxic granulation. Okay? Toxic granulation, which we can see, saan? Toxic granulation is usually seen in most typical of your severe septicemia. So, toxic granulation, yun yung ating nakikita. Number 56. Okay, number 56. Okay, kung hindi nyo makita, okay, pasensya na. Okay ba kayong inyong mga notes? Hindi nyo makita yung clear na picture, but that is Burkitt's lymphoma. Okay? That is Burkitt's lymphoma. Now remember, when it comes to your Burkitt's lymphoma, anong meron sa ating Burkitt's lymphoma? Okay? Sa ating Burkitt's lymphoma, anong lagi yung tatandaan? In your Burkitt's lymphoma, there are usually, kung makikita ninyo dun sa screen, I hope you can see it clearly, they are almost the same in size. Pare-pareha sila ng size. And that is, that is, paano ba natin sabihin? That is definitive, or that is a distinguishable part when it comes to your Burkitt's lymphoma. All of those are lymphocytes. Okay, all of those are lymphocytes. And you can see clearly na pare-pareha sila. Okay, and they already almost filled your smear. Okay, number 57. Number 57, which of the following statements, okay, number 57, mic test, mic. Okay, let's go to number 57. Which of the following statement is true about your hairy cell leukemia? Hairy cell leukemia, lagi niyong tatandaan, this is TRAP positive. Okay? TRAP positive. So, anong meron dito? Young adult splenomegaly. Okay, letter C. Okay, that is your tartrate-resistant acid phosphatase. So, it is TRAP positive. Number 58. Ayan. Mike, 1, 2. Okay, number 58. An increase in your basophils is associated with which of the following? Chronic infection? No. Administration ng glucocorticoids? Hindi. Bababa ang ating basophil niyan. Chronic infection? Neutrophil. Parasitic infection? AO. So, chronic myeloproliferative disease is the answer. Which of the following is not classified as myeloproliferative disorder? Not classified as myeloproliferative disorder. Answer is letter C. Okay? Bakit letter C? Pag sinabi natin myeloproliferative disorder, there is a problem in the production of your WBC. Ibig sabihin, mataas o mababa. No, since we're talking about myeloproliferative, increased production of your WBC. Ano bang meron sa multiple myeloma? Multiple myeloma is an increase in the production of your immunoglobulins. Okay, so multiple myeloma, there are abnormal plasma proteins, or rather plasma cells that excessively produces your what? Excessively produces your antibodies. Okay, that's number 59. Number 60, mga kapatid. Okay, number 60. In which of the following would an absolute monocytosis can be seen? Okay? In which of the following can an absolute monocytosis can be seen? Absolute monocytosis, mga kapatid, makikita natin sa infectious mononucleosis. Okay? Number 60, infectious mononucleosis. Okay. Number 61. Okay. Number 61. Number 61, an acute leukemia can be described being, basahin natin isa-isa. All of them are in short duration kasi nga acute. Okay? Letter D, mali na. Can many mature or many mature? So, mali agad tong mature. Many immature alteration. Okay. So, remember, when it comes to your leukemia, ano yung key point natin sa leukemia? Okay? When it comes to leukemia, increase immature cells. Okay? Increase immature cells, and since we're talking about acute, it is only for a short-term duration. So parang yung um, biglaan yung onset ng ating mga symptoms. Okay? Biglaan yung onset ng ating mga symptoms. Now, let's proceed to number 62. Which of the following is not commonly found in acute myelogenous leukemia? Okay, hindi daw nakikita sa acute myelogenous leukemia, myelogenous leukemia, lymphadenopathy. Bakit po? Because remember in your myelocyte, okay, your common myeloid progenitor only gives rise to your RBC, WBC, ano pa ba? WBC, and your platelets, and your monocyte. Ito kasi makikita mo lang kapag mga lympho. Eh, ang common myelogenous, ito yung mga problem natin. RBC, o yan, sa spleen. Thrombocytes, ayan. Neutrophils, ayan. Okay, clear tayo dun guys ha. Again, ulitin ko, sir, bakit? Bakit po yun yung sagot? Kasi pagdating sa ating myelogenous or sa ating common myeloid progenitor, myeloid, lymphocytes ay hindi kasama. Okay, number 63. Undifferentiated blast Okay? Undifferentiated blast for your AML. Okay? Kapag undifferentiated yung ating AML, acute myelogenous leukemia, if you can turn um to your notes, remember yung ating AML can be M0, M1, M2, M3, and M4. How can we differentiate them? According to the presence of your immature cells. Now, ang sabi dito, undifferentiated daw lahat ng blast. Okay? Ibig sabihin lahat immature. Undifferentiated, so that is MO. Okay? So, MO, myeloid. Okay, M0 myeloid. That is for acute myelogenous leukemia. Okay, one moment. Okay, let's ask. Okay, ayan. Let us proceed. Number 64. Acute megakaryocytic leukemia daw. Okay, acute megakaryocytic leukemia is classified as what? According to our um AML classification. Okay, according to our AML classification, anong anong type ng acute myelogenous leukemia kapag puro mga thrombocytes or mga megacardiocyte. That is M7. So remember, M6 RBC. Okay? M6 RBC, M4, and M5, mga monocytes, yung mga ganyan. So, when it comes to M7, that is megakaryocytic by nature. So, answer, pag megakaryocyte, M7. Number 65, Philadelphia chromosome is Philadelphia chromosome is a translocation of what? That is 22 to 9. Lagi yung tatandaan, 22 to 9. Okay, so 22 to 9, that is letter C. Philadelphia chromosome. Okay? Philadelphia chromosome. Number 66. Number 66, which disease is characterized by the presence of this type of cell? Kung makikita ninyo, okay, dun sa ating screen right now, okay, if you can see, dun sa ating screen right now, yung ating um yung ating WBC, okay, yung ating WBC has a what? It has a distinct, okay, appearance. No, anong tawag natin sa cell na yan? This is what we call now your Reed Sternberg. Okay, Reed Sternberg WBC. Okay, your Reed Sternberg WBC are seen in your Reed Sternberg WBC is what is being seen here on your screen. Okay? So that is number 66. Number 67. Okay? If the stain cannot be performed immediately, the smear should be fixed and stored at negative 20 degrees Celsius up to 2 weeks. Wrap the cell prior to storage. So, saang preparation ito ginagawa? That is for your acid phosphatase stain. So, remember, for you to preserve, okay, for you to preserve the enzymes within your WBC, you need to preserve them, fix them, and store them at negative 20 degree Celsius. Number 68. Okay, number 68. It is used to stain mucoprotein. Okay, number 68. It is used to stain mucoproteins, okay, glycoproteins, and high molecular weight carbohydrate. These are usually seen, lagi yung tatandaan, basta ang chinecheck na natin ay carbohydrates or mga sugar doon sa ating WBC. That is for letter T. Kung matatandaan nyo pag matatandaan nyo sa histopath, di ba, pag stain for carbohydrate, that is your per iodic acid shift. Okay? Again, that is your per iodic acid shift. Hindi po yan periodic acid ha. Wala pong periodic acid. That is per, meaning to say one iodine. Okay, it contains one iodine. That is per iodic acid shift. Okay, number 69. Number 69, eto na, Di Guglielmo. Okay, Di Guglielmo. Okay, Di Guglielmo syndrome. Ako lagi ko tinatandaan dyan. Pag Di Guglielmo, Di Guglielmo, G, number 6, para siyang letter 6. That is M6. Remember, kapag M6, ano ulit yung ano natin? Kapag ang ating mga tawag dito, ating AML is classified as M6, that is your erythroleukemia. Okay, that is your erythroleukemia. Number 70. Washington Monument. Okay, Washington Monument, that is Washington DC, pero DC, that is hemoglobin SC. Okay? Number 71 to 75, more on matching type na lang tayo. Okay? Number 71, saan natin nakikita ang ating mga leptocytes? Okay? Ang ating mga leptocytes ay nakikita natin sa hepatic disorders. Okay? Hepatic disorders. And what are leptocytes, everyone? Leptocytes are commonly known to be your what? Your leptocytes. Okay, your leptocytes are commonly known. Wait lang. Wait. Okay. Going back, hindi ko siya ma-zoom guys, sorry. Your leptocytes are seen in your hepatic disorders. Seen in your hepatic disorders. Letter A, ayun to pala yung sagot. Letter A, your microspherocytes. Okay, your microspherocytes are usually seen in your hemolytic disease of the newborn. Let hemocodocytes. Okay, codocyte like thalassemia, ganyan. Codocyte seen in your codocyte are seen in your hemoglobinopathies. The cryocyte that is in your myelofibrosis. Bakit myelofibrosis? Kasi nga, di ba, siksikan dun sa bone marrow, pinagpilitan ng RBC makalabas, kaya naipit yung kanyang dulo, nagmukhang the cryocyte or your teardrop cell. Your schistocyte, sabi natin, your microangiopathic hemolytic anemia, pinag-uusapan natin kanina, it destroys your RBC inside your blood vessel, forming now your schistocyte, your schizocyte, or your fragmented RBC. Okay. Number 76 to 80. Basophilic stippling. Saan daan na natin nakikita ang basophilic stippling? Letter D. Tama. Ang basophilic stippling nakikita natin sa lead poisoning or also known as your plum BSEP. Okay, your plum BSEP. Number 77, Howell Jolly Bodies. Ang Howell Jolly Bodies natin, saan natin nakikita? That is seen because of problem in your DNA. Saan may problem ng DNA? Kapag may problem ka sa vitamin B12, which is in your pernicious anemia. Number 78, Heinz bodies. Napag-usapan natin kanina. Heinz bodies, denatured hemoglobin. That is because of your deficiency in your glucose 6-phosphate dehydrogenase deficiency. Okay? Dito mo nakikita yung bite set. Okay? Number 79, Pappenheimer bodies. So, Pappenheimer bodies, latandaan, laging iron yung mga yan. Sa Pappenheimer bodies, anong problem natin? That is your iron loading anemia. And your Cabot ring, saan natin nakikita ang Cabot ring? Ang Cabot ring, yan yung 8 na figure. Those are mitotic. Those are my one moment. Sorry guys, huwag niyo ko tawanan kung naririnig niyo itong video na to. Now, okay, your mitotic fibers, okay, are usually seen in your myelodysplastic anemia. Okay, we're close to the end. Okay, siderotic granules. Saan natin anong component ng siderotic granules? Nakikita mo ang siderotic granules sa inyong mga um, hemochromatosis, hemosiderosis, that is letter B. Okay, iron. Okay, iron. Cabotrains, pinagsabi natin kanina, those are spindle fiber, mitotic spindle fiber remnant na letter 8, cabotrains. Basophilic stippling, ano meron sa basophilic stippling? RNA siya. Okay, so that is letter D. Howell Jolly bodies, that is DNA. Okay, and your Heinz bodies, these are, sabi na natin kanina, denatured hemoglobin. Okay, okay, mabilisan na lang. AML with maturation. Okay, AML with maturation. So meron kang pagpipilian, M0, M1, hanggang M7. So unahin natin yung mas madadali, M7, that is for what? Megakaryocytic, yung mga megakaryocytic ano natin, o let's highlight. Megakaryocytic ano natin, M7. Pagdating naman sa erythroleukemia, that is M6, Digugel mo, without maturation, okay, na ano natin kanina, myeloid leukemia without maturation, okay? Without maturation, that is letter B, M1. Well, hinahanap natin si M0, pero wala. Pagdating naman sa myelomonocytic, okay, myelomonocytic, that is what? Myelomonocytic that involves now your M4. Okay, your M4. And for your myeloid leukemia with maturation, that is letter D, M2. Okay, that is letter D, M2. So, that is for your leukemia, ha? Let's move forward. Last 10 questions. Okay? So, ito, makikita natin, meron kang, the following are usually seen in, actually, alam niyo, nung tinitingnan ko din tong 91, hindi ko alam kung saan ba ko titingin. Doon ba sa RBC or doon ba sa RBC or doon ba um, sa RBC or doon sa nasa gitna na WBC. So, ang lahat ng choices pertains to your RBC. So, hindi ko na tinignan to. Okay? So, kung titingnan mo yung mga RBC natin, malalaki siya, malalaki yung gitna. Okay? So, obviously, hindi siya ITA. Malalaki, hindi rin siya thalassemia. Siderotic anemia, meron bang inclusion bodies? Wala. So, ako, naiwan lang ako with megaloblastic anemia at nakumbinsi ko naman yung sarili ko. Okay, malalaki yung cell, okay? Malalaki yung central pallor, and maybe, just maybe, kaya merong WBC dyan, that is for size comparator. Okay? Your WBC is for size comparator. So, ang sagot natin sa 91 ay letter A. Number 92, which of the following is not a characteristic of polycythemia vera? Ano daw ang hindi, okay, not characteristic ng primary polycythemia vera? Blood pancytopcytosis, kasama red cell mass, viscosity, letter C. Okay, hindi po erythropoietin ang primary cause ng polycythemia vera dahil ang problem natin nasa bone marrow. Number 93, which of the following represent the physical defect of chronic CGD or chronic granulomatous disease? Hindi po yan. That is lazy. This is for Jobs disease and for lazy leukocyte disease, phagocytosis, hindi yan yung problem. Lysosomal function node, that is for the oxidative respiratory burst. And please do remember, kanina yung mga minention nating enzymes that are not functioning because of your CGD. Okay, a Gaucher cell. Okay, Gaucher cell, lagi nyo tatandaan, ang Gaucher cell may fat deposits. Okay, Gaucher cell may fat deposits, specifically your glucose erythrocyte that causes it to appear wrinkled, and that is for your Gaucher cell, for your WBC, specifically your macrophage. Alder-Riley. Alder-Riley kanina, sabi natin, yung Alder-Riley merong problem sa yung mucopolysaccharide metabolism, kaya magkakaroon ka ng positive test sa per iodic acid shift. Okay, per iodic acid shift. Number 96, RBC destruction that occurs when macrophage ingest or destroy RBC. Obviously, ayan na siya. Macrophage mediated. Okay? Number 97, remember has spleen, that is the graveyard of your RBC. 97, in hereditary spherocytosis, a characteristic abnormality in your RBC result. Okay, hereditary spherocytosis. Kung matatanda nyo kanina, Spherocyte, mataas ang MCV, mataas ang MCH, at mababa, normal ang MCHC. So hanapin natin, increase MCV, yes, characteristic abnormality of in your CBC. Increase decrease ano ba to? In hereditary, a characteristic abnormality of your CBC is decrease yung MCH. Okay, so the answer, wait, I'm actually wondering bakit ito yung sagot. Kasi pag may spherocytosis ka, mataas ang iyong MCV kasi macrophage, ay macrocyte. Okay. So, letter B ang sagot ni Ma'am April. So, I'm assuming, ito yung ano ko guys ito yung ano natin. Okay, we are talking about hereditary spherocytosis. Hereditary spherocytosis, if you look into your RODA, usually they are not large in size, not large in size. Pero pag may spherocytosis ka kasi na ibang cause, malalaki talaga yung RBC natin. So for the sake of this number, titignan ninyo kung hereditary siya, okay, sige, yung MCV, yung MCHC yung mataas. Pero pag yung normal na spherocytosis, ano yung kailangan ninyo tandaan sa hereditary spherocytosis natin? Ang concern natin has to do with your what? Has to do with your MCV and MCHC. Okay, number 98. We're close to the end. Number 98. What RBC morphology is characteristically found in the first 24 hours ng extensive burn? May sunog, sunog yung pasyente, ano yung makikita natin? Okay, schistocyte, fragments, and microspherocytes, crenated RBCs. Number 99, painful crisis and patient with SCD, sickle cell disease, occur as a result of splenic sequestration, hindi, aplasia, no, anemia, no, vaso-occlusion. Vaso-occlusion, painful crisis, happens when a certain part of the body, okay, kung minsan nga sa lalaki, this is your priapism, okay, your priapism, yung penis ng lalaki, erected, okay, sasabihin nyo, ay, edi maganda. No. Kasi yung erection ng penis ng lalaki is um, because of accumulated sickle cell in their blood vessel causing vaso-occlusion, bumaradon, yung mga red blood cell causing a painful erection. Okay, so it's not a pleasurable erection to start with. So that's what you're going to expect with it. Okay, number 100, last, hereditary erythroblastic multicellularity with positive acidified serum is also known as what? O, di ba ang haba? Okay, what is the other name for your hereditary, okay, um, hereditary erythroblastic multinuclearity with positive down na ano, with positive na acidified serum test, okay? Acidified serum test. So that is your CDA, okay, or your congenital dyserythropoietic anemia type 2. Okay? So that is usually, okay, that is usually um, characterized with your RBC being multinuclearity with positive acidified serum test, okay, or yeah, positive serum acidified test, or also known as your acidified serum lysis test. Kapag positive ka doon, meron kang congenital, okay, this erythropoietic anemia type 2. Okay? So, I guess that's it for me, my dear interns. Um, hopefully, yung discussion natin will be helping you in answering your exams in the future. So, thank you so much for listening. God bless everyone, and I'll see you very soon.